My name is Dr. Meghraj Ingle. I am a practicing hepatologist and gastroenterologist associated with Lokmanya Tilak Municipal Medical College and General Hospital, otherwise also called as Sion Hospital. Today we will be discussing in brief about hepatitis. The term hepatitis generally means swelling or inflammation of the liver. One of the commonest causes of hepatitis is a viral infection of the liver. Normally, there are many viruses which can affect the liver, but the common viruses are called as hepatitis A, B, C and E, of which hepatitis A and E cause the very frequent and milder form of hepatitis, or jaundice as we commonly know it, which is the form of jaundice that is commonly seen during the rainy season and is seen in children and young people alike, and which commonly spreads through contamination of food and water. Normally this type of hepatitis generally has almost complete recovery within 6 weeks. Very rarely do patients have serious complications, and very rarely they go on to develop chronic hepatitis. Vis-a-vis the other two hepatitis viruses, that is hepatitis B and C, they can affect the liver and they can go on to develop a chronic infection which is called as chronic hepatitis B or C respectively, and which can in some patients over a period of time damage the liver significantly to cause chronic liver disease or cirrhosis, and which can progress to have other complications like bleeding from the esophagus, develop ascites, or what is commonly called as fluid accumulation in the abdominal cavity. Occasionally these patients can also have certain effects on the brain, which we call as encephalopathy, because of the improper removal of the toxins by the liver. And these patients then also are at high risk of developing hepatocellular carcinoma, or commonly what is called as liver cancer. So now let us discuss a bit more about hepatitis B and hepatitis C. Both these viruses are normally transmitted via the transfer of blood and body fluids. Regarding hepatitis B, after alcohol, it is one of the commonest causes of chronic liver disease or cirrhosis in our country and also in most of the other countries. Around 400 million people around the world are affected by this virus. The common modes of transmission of hepatitis B is from mother to child during delivery, by sharing of needles, razors, toothbrushes, by transfusion of contaminated blood, can also occur during surgery if the surgeon gets exposed or has a cut, or the doctor has a cut from an infected patient, and also in patients who have renal problem who undergo hemodialysis. Most of the patients when infected with hepatitis B are asymptomatic, and they normally manifest with the chronic problems later over a period of next 10 to 20 years. Very few patients will have acute manifestations like fever, body ache, jaundice or yellow discoloration of the urine and the eyes. Similarly, hepatitis C is commonly transmitted by transfer of predominantly blood products, so that is during blood transfusions and also during hemodialysis. Another important mode of transmission is unprotected sexual intercourse, where it can spread from male to female and from female to male. So how do we detect hepatitis B and C infection? As I said, most of these viruses present as a chronic infection, so they are detected incidentally in majority of the cases when patient is tested for these viruses, for example during pre-employment, or when he is ill for some other reasons, or when he is undergoing any major surgical procedures. So one of the important modes of preventing this infection from occurring or from getting this infection is prevention. As most of it will be silent, we will not detect till the chronic effects are there. So what are the ways of preventing this infection? Various ways of preventing are to avoid the high risk activities, that is avoid sharing of needles, sharing of toothbrushes, have protected sexual intercourse. To test the mothers, all the pregnant ladies during pregnancy for the hepatitis B is a very important mode, as this is the commonest way of getting the virus in our country. Because if the mother is found to be positive, there are very effective means in the form of oral medications and injections which can be given to the mother during pregnancy and also to the child immediately after birth to prevent the infection from mother to child. Another important, this is regarding hepatitis B. Also, another important way of preventing hepatitis B is vaccination. Very effective vaccinations is available. It is a 3-course vaccine given at 0, 1 month and 6 months. A simple vaccine without major side effects, which can be given to almost all individuals at any age, and confers almost 90 to 95% protection against developing future hepatitis B infection. As a result, it has been now recommended in our universal immunization program, and also individuals who are at high risk, that is healthcare workers, patients who are taking care of hepatitis B positive individuals, patients who are undergoing hemodialysis, all these high risk individuals should get themselves vaccinated for hepatitis B. Coming to protection against hepatitis C, unfortunately there is no vaccine available against hepatitis C. So the best way is to make sure that if at all any blood transfusion is required for the patient, it is done from reputed labs which check blood banks, which check for hepatitis B and C. And so also for patients who are undergoing chronic hemodialysis for their kidney problem should get themselves tested and should do it from reputed centers. Is there a treatment available for hepatitis B and C? Yes. Effective treatment in the form of drugs and injection is available for both hepatitis B and for hepatitis C. For hepatitis B, the major aim of the therapy is to decrease the virus quantity in the body and thus decrease the ill effects of the virus on the liver and protect the liver from chronic damages like going into cirrhosis and the other ill effects, including development of hepatocellular carcinoma. This can be done effectively with the form of drugs as well as injections, and in some cases the virus can be completely removed from the body. These drugs and injections are now very easily and very widely available at all the major hospitals across the city and the country. Regarding hepatitis C, very effective treatment is available now to remove the virus completely from the body, depending upon the type of hepatitis C virus, which are normally virus 1, 2, 3 and 4. Depending on the type of the virus, the cure rate, that is complete removal of the virus, ranges anywhere from 50 to 80%, which is good cure, considering the side effects of the virus. So any patient who is detected to be hepatitis B and C, if there are no symptoms, and most of them will not have any symptoms, they should immediately report to their doctor or to a liver specialist, and we can do certain tests to find out whether the virus is active or not, whether there are some slow underlying damage occurring to the liver or not, and we can start treatment at the right time to prevent further damage to the liver. So my message would be to be safe, have safe practices in our day-to-day lifestyle. Be aware of the symptoms of acute hepatitis. Get yourself tested for that, for the viruses, which is a simple test available in most of the city hospitals and the labs. And if at all, try to get yourself vaccinated. Almost anybody can get themselves vaccinated. It's a simple vaccine, just 3 injections, which do not pay much, do not cost much, and you can be at easy risk. You can be at ease and not at any risk of developing the viral infection, especially hepatitis B. And if at all you are detected or any of the family members is detected, even if you are asymptomatic, kindly report to the earliest to your treating physician or to a liver specialist and get the further test done, so that right treatment can be started at the right time to prevent further damage to the liver. Thank you.